everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have started discussing about catheterization, there we have come to know that urinary catheterization is defined as the process of inserting a catheter through the urethra into the bladder. And this is mainly done for those patients who is having urinary incontinence, or even for those who is not able to urinate because of their disease condition. So in that session, as we have discussed in detail about the types of catheter which is available, about the technique of catheterization, as well as about the various points, and also what assessment needs to be done before performing this procedure. In this session, we are going to discuss about the insertion of an indwelling catheter. So here, why is this catheter inserted? As I've said, that this catheter is inserted in order to prevent the occurrence of the urinary incontinence, as well as to initiate the urination of those persons who will not be able to urinate by themselves because of their disease condition. So here, especially when we provide an indwelling catheter, it is very important that this catheter must be left in place, right? So why is this important? This is important because by the insertion of this indwelling catheter, it helps in the gradual decompression of the overextended bladder. It is also used for intermittent bladder irrigation as well as for a continuous bladder irrigation. So here, as you can see in the picture, that this is what an indwelling catheter looks like. So here you've seen, right, that there is a presence of a balloon at the tip of the catheter. So why is this present? This is present so that once the catheter is being inserted into the bladder, this balloon will be inflated, and this balloon, as it is inflated, this will be larger than the opening of the urethra. So here, in this manner, it will help to retain the catheter in place. So here again, I'll be saying that, as you can see in the picture, that this is how an indwelling catheter looks like. So here you can see that at the tip there is presence of a balloon. So here, once this catheter is being inserted, the balloon will be inflated, and once this is inflated, this size of the balloon will be larger than the opening of the urethra. So in this manner, it will help to retain the catheter in place. So now let us discuss about the steps that we need to follow when we are inserting this catheter. So here, the first one is we must perform hand washing. As I've repeatedly been saying in each and every procedure, that hand washing must be done before performing any procedure for the patient in order to prevent the spread of microorganisms. So even here, before you perform this catheterization, before you insert the catheter into the bladder, you must make sure that you wash your hands. And then you must lift the draping sheet back towards the abdomen with the use of your elbow and only expose the perineum. Because here, as I've said, that when we provide catheterization, we cannot expect the person to wear pants, right? Here, what we will be doing is, in order to provide privacy for their body parts, we must drape the patient with the sheet. So here, before we insert this catheter, we must make sure that we drape them with the sheet. Then we must lift the sheet back towards the abdomen with the use of our elbow and only expose the perineum of the patient. And once this is done, we must then open the sterile tray by using the aseptic technique. And once it is open, then we must put on our gloves. Then we must place the sterile towel and slit in position. And then we must also place the sterile kidney tray on the sterile towel in front of the patient. And once this is done, then we must start lubricating the catheter and place it in the sterile kidney tray. And once these are done, then we must clean the perineum of the patient before we insert the catheter. And how will we clean it? We will clean it with the use of the cotton balls, which will be dipped in the antiseptic solution, and by the use of a forceps. So here you must also make sure that you keep the labia separated and pull upward from the time the vulva is clean. until the time the catheter is being introduced. Then you must pick up the catheter and hold it 7.5 centimeter from the tip and place the distal end in the sterile kidney tray. So here, as I've said, that before you even insert this catheter, you should make sure that you first clean the perineum. So here, once cleaning of the perineal areas are done, here you must make sure that you keep the labia separated and pull upwards once the vulva is done, and you must continue doing this until the catheter is introduced. So here, even before you introduce this catheter, you must pick it up with the glove hand holding it about 7.5 centimeter from the tip, and you must also place the distal end of the catheter in the sterile kidney tray so that this does not become infected. Then you can start gently inserting the catheter about 5 to 7.5 centimeter. And once this catheter is inserted, once it is introduced into the bladder, then the urine will flow into the kidney tray. However, if the urine does not flow even after you have inserted this catheter for about 5 to 7.5 centimeter, then you must make sure that you rotate the catheter. So once this is inserted, you can then release the labia minora, but here you must make sure that you still hold the catheter with the same fingers. Why? Because here, as I've said in the beginning, that an indwelling catheter contains a balloon at the tip, right? So here you must make sure that you first inflate the balloon before you release the catheter so that this catheter will be retained in the proper place. And once this is done, you can collect the urine specimen if required, or you can even directly attach the drainage tubing. However, if an indwelling catheter is not used, that is, if just a straight catheter is used, then this we mainly do it for obtaining the urine sample, right? For obtaining the urine specimen. So here, if instead of an indwelling catheter, if we use a straight catheter, then we can obtain the required urine specimen, and then we can even remove it as soon as the specimen has been obtained. So this is done in case if an indwelling catheter is used. However, if we use a straight catheter for which we only need to obtain the urine sample or the urine specimen, then here, once this catheter has been inserted, we can obtain the specimen required and then we can remove it. But here, while you are removing, you must also make sure that you do it slowly. You should not pull it by force, or you should not, pull it in a very quick manner. But here, even while you are removing, just as how you are inserting, you must also make sure that you remove the catheter slowly. However, if we are using an indwelling catheter, or if an indwelling catheterization is being ordered for the patient, then here we must make sure that we inflate the balloon with the pre-filled syringe before we even insert the catheter in order to check the balloon patency. And once we have determined that the patency of the balloon is normal, then we must aspirate the fluid back into the syringe. So this determination of the patency of the balloon will be done before it is inserted, right? However, once the catheter has been inserted, once you have, hold the catheter in place and only left for the balloon to be inflated, then here you must inflate the balloon according to the manufacturer instruction. So here you must inflate the balloon according to the manufacturer instruction, and also here you must make sure that you inflate it as soon as possible as this balloon has entered into the bladder and even before the urine has drained from the bladder into the kidney tray. So here, while you are inflating the balloon, we usually use 5 ml to 10 ml of sterile water. So here, once the balloon is inflated, if the patient is complaining that he or she is having pain, then we must allow it to empty and we must replace the catheter with another one. And since this balloon will be placed in the urethra, then there may be some patient who may experience discomfort, which can also lead to distension of the urethra. So here it is very important that we exert slight tension on the urethra. after the balloon is inflated in order to assure its proper placement in the bladder. So once the catheter has been inserted, once the balloon has been inflated, and if the patient is not having any complaints of discomfort or pain, then we can start connecting the catheter to the drainage tubing as well as to the drainage bag. And once this is done, we must tape the catheter along the anterior aspect of the thigh if it is for a female. And also while doing this, we must also make sure that there is no tension on the catheter when it is taped to the patient. And once the catheter is taped, then we can hang the drainage bag on the frame of the bed below the level of the bladder. So these are the various steps that you must follow whenever you are inserting the urinary catheter. So here, as I have said, that if a catheter is being inserted, if a straight catheter is inserted just for obtaining the sterile urine specimen, then here this catheter will be inserted, the urine specimen will be collected, and then immediately this catheter will even be removed, right? So here for these type of patient, no evaluation or no catheter care must be provided. However, if a patient is under the indwelling catheterization, then here as a nurse, we must make sure that we provide catheter care to the patient. And not only that, but we must also evaluate their condition. So here, even before we provide care to these patients, we must make sure that we first wash our hands in order to prevent the spread of microorganisms and also in order to prevent the cross-contamination. And then we must start cleaning the perineal area thoroughly, especially around the meatus, twice a day and after each bowel movement. And why do we do this? We do this in order to prevent the microorganism from entering into the bladder, because here, as we know, that if any microorganism enters the bladder, then it can cause various types of infection, right? So in order to prevent this from happening, we must make sure that we clean the perineal area, especially around the meatus, twice a day and even after each and every bowel movement. Here for cleaning the perineal area, we can also use soap and water. However, when this is used, we must make sure that we rinse it well and we also dry it properly. And if a patient is under catheterization, then we must also make sure that the patient maintain a generous fluid intake, because here, by maintaining a generous fluid intake, it helps to prevent the development of any infection, as well as it irrigates the catheter naturally by increasing the urinary output. We must also encourage the patient to be up and about as ordered. We must record the intake and output of the patient. We must note down the volume as well as the characteristic of the urine which we have observed in the urinary bag. We must also educate and teach the patient about the importance of maintaining personal hygiene, especially the importance of carefully cleaning their perineal area after each and every bowel movement, and also the importance of thoroughly washing their hands after cleaning their perineal area. And as a nurse, while we are assessing the condition of the patient, while we are attending these patients, while we are hearing their concern, we must also make sure that we record and even notify to the physician if there is presence of any sign of infection. And these signs of infection include a burning sensation, irritation of the meatus, a cloudy urine, a strong odor of the urine, as well as an elevated temperature or even presence of chills. Because here, if a person is having fever, if a person is having chills, burning sensation during urination, irritation around the meatus, as well as a cloudy urine or a strong odor urine, then these are few signs of developing an infection. So here, if any of these signs has been observed, or if the patient is complaining that these signs are present, then this must be clearly noted as well as notified to the physician. And here, if a person is under indwelling catheter, we must also make sure that we plan to change the indwelling catheter as necessary, because here this indwelling catheter will be provided until the person is able to void by himself, or until a person is able to void voluntarily. So here we cannot expect that, we can provide the same catheter for a week or for even a month. Here we must make sure that we change this indwelling catheter as necessary, because this usual time length for the catheter to be changed may vary and can also be anywhere from 5 days to 2 weeks. So here we must make sure that we properly consult the physician as till which duration can this catheter be used and when it must be changed, because here, yes, we cannot use this catheter for a long period of time, but we should not even change it frequently, because if this is done, then there is more likelihood of an infection to occur. So here we must make sure that we must not provide the same catheter to the patient for a long period of time, but this catheter must also not be changed frequently in order to make it less likely for the patient to develop any infection. So these are the various points that you need to keep in mind when you are providing care to a patient, especially who are under an indwelling catheter. So now we have come to the end of this topic, whereby in today's session we have discussed in detail about the various steps we need to follow when we are inserting the catheter, as well as about the points that we must keep in mind whenever we are providing care to a patient under an indwelling catheter. So I hope you have got a clear understanding of this topic. I'll be meeting you in another session where we will be discussing about the various steps that we need to follow when we are removing this catheter. So until then, have a good day. Thank you.